All right. So let me give you a magic wand. Let me
Okay.
give you a crystal ball and a magic wand here,
Okay.
Lisa. And if you could wave your magic wand, how would you fix documentation in the dental world? I want to hear what you have to
Oh,
say about that. I
how would
know.
I
See, but
fix?
I knew that I hear the sigh, but I also
Yeah.
hear the, ooh, I have a lot to say.
Yes. How would I fix documentation? Are we saying from the office perspective?
Yeah. Yeah. Like,
Don't
what could
copy,
offices do? Okay.
don't copy and paste your notes. Don't
Okay.
copy and paste your notes. Yeah.
Did you hear that, people? Did
Yeah.
you hear
Don't
that?
don't copy and paste your notes because it always comes up in an audit. Pics or it didn't happen. I say that all the time. Like
Mhm.
intraoral cameras in an office and an operatory is makes a huge difference, I think, with documentation. And document the day of the procedure. Don't wait and do it on the weekend because plans, when they're going through audits, will take a look at that. And if their notes are not matching on the different days, they're going to question it. Yeah.
All right. So, what
Yeah.
if I'm swamped? I had three people call out. Like, what's an acceptable a day?
Yeah, a day. Yeah, a
Okay.
day. Yeah, sure, a day.
All right.
Yeah. But
All right.
I mean, we see offices that are not documenting and not completing their treatment for a week afterwards. And, looks a little odd when your x-rays state one day, but then the treatment is charged out on a whole different day. So,
Yeah, that's interesting. Oh, here's a question for you. And I know this
mhm.
is going to vary state by state. So, I was just interested. When the record is signed, does it have to be in California signed by the doctor or can the assistant sign it?
No, it has to, it's the doctor's license. It's the doctor's license on the line for that.
So
Yeah.
I see this everywhere. I see this
Hmm.
everywhere when somebody sends me a clinical note to say is this okay. I hate to say it's never okay. There's always something that you could have improved in the clinical notes, but by far I see the assistant's initials. And as the assistant, I only work with this doctor, so of course it would be me. But that doesn't fly, does it?
No, it doesn't. No, as far as state laws, it doesn't. Yeah. We encourage even associate dentists to do a chart audit and to go back and take a look and see what's been billed out, what's been submitted, what's coming back on the EOBs. We've seen where we've looked at day sheets that the exam was charged out under the hygienist's code. So,
Oh,
hygienists can't do exams in California. So, certain things
right.
like that. So, we always encourage our associates just to not wash your hands of it, not think that someone else is taking care of it. It's your license that's on the line. So, you have to make sure that you're protecting your license as much as possible.
So I can see the rationale of the hygienist getting the credit for the exam because maybe that's part of the structure of the compensation, but on the day sheet, it shouldn't say the
Mm-mm.
hygiene
No, yeah.
initials. Okay,
Yep.
interesting. Okay, so they'll have to figure another
In
way.
California, it's beyond their scope. Yeah.
In most
Yeah.
states it is.
Yeah.
Yeah. So interesting. Okay, I'm thinking about a couple of offices that I know of now that the hygienist gets credit for the exam because it's happening in that operatory,
Yeah.
but obviously the doctor does the eval.
Yeah, exactly. If the
Okay.
hygienist is being financially compensated for it as a, part of their contract, their employment contract, that's one thing. But as far as it being charged out, the doctor still needs to do the exam. The doctor still
Mhm.
needs to make the notes. Yeah.
Interesting. Okay.
Yeah.
So the other thing that I see often is no review of medical history or medical history reviewed. That's it. That's
Sure.
it. Just
Yeah.
medical history reviewed. And then I also see no blood pressure. Like I'll see the template and it's blank. Like the numbers are blank. They're not
Hmm.
added in there. Is it medical history reviewed? Is that enough or not really?
Medical history reviewed, no changes noted. Yeah. It's similar to, I kind of think about it when you have a patient that comes in to the office and they're an existing patient and you ask them the question, has anything changed since you were here last? Their
Hmm.
immediate response is no. They don't have to think through it. But when we're talking about insurance, do you still have XYZ insurance through ABC company? It makes them start to think a little bit. I think the medical history is along the same lines. Hey, we have it noted that you have, you're on this medication, you have this medical condition, you have that. Has anything changed on it since then? Instead of just asking them a blanket question, has anything
Yeah.
changed? Because my immediate reaction to that is no.
Right. And then
Yeah,
afterwards you go home, you're like, oh, I had that big surgery over Christmas. I
exactly.
totally forgot to tell. Because
Yeah,
6 months
yeah.
is a long time that we see
It sure
them.
is. Yeah,
A lot
yeah.
of things change. Would you like to hear more? Follow the link for the full episode.